Thank you, everybody. We'll begin our briefing for COVID update alert this afternoon with the Premier and Dr. Shahab in 2 minutes. This is your 2-minute warning. Thanks. Important public health information. Pandemic don't stop. Stuff as we get trained up to keep working. The order. Thank you for joining us today, everybody. Here in the building today, we have Premier Scott Moe and Dr. Shahab, Chief Medical Health Officer for the province of Saskatchewan. On the phone, we have Scott Livingstone, CEO of the Saskatchewan Health Authority. I believe we'll start with brief comments from both Premier Moe and Dr. Shahab, and then go to questions. Thank you. Premier?
Well, thank you very much, and good afternoon, everyone, and thank you for joining us here this afternoon. Today, we are reporting 10 additional cases with 9 more recoveries. This gives us a total of 146 active cases across the province. Our case numbers yet remain quite low compared to other provinces, and our positive test rate remains well under 1% on most days. But we have seen case numbers go up a little bit here in September. Many of the larger spreader events, both here in Saskatchewan and in other provinces across our nation, have been the result of a few people that have chosen not to follow the public health orders and the guidelines that are in place. I know the overwhelming majority, the vast majority of Saskatchewan people are doing their level best to adhere to all of the good advice and the direction that has been provided by Dr. Shahab and his team over the course of the last number of months. When we get in trouble, and where we get in trouble, is when people step outside of this advice and direction. There have been some instances where the rules were not followed, even for an instance, and that has led to some outbreaks in this province. So we need to continue to be careful. We need to continue to keep limiting our gathering sizes, to continue to keep our physical distancing in place, to keep washing our hands and washing them often, and to wear a mask where it is appropriate. If you're feeling sick in any way, you should stay at home. You shouldn't go to work, you shouldn't go to school, you shouldn't go shopping, you shouldn't go to a meeting, you shouldn't go to a friend's house. I know people in this province are quite tough. When we're feeling a little under the weather, we're used to just powering through it, if you will. And I'm still going to work, and we're still going to go about our daily lives. But at this point in time, we are just not able to do this. The risk is just too large. We've seen a number of examples of how one infected person at the wrong place, at the wrong time, can quickly turn into dozens of additional cases. So if you're feeling unwell at all, go to get tested and stay at home and wait for your results. Let's all make sure that we are doing all of the things that we need to do to keep those around us safe, those in our community, those in our families. The Saskatchewan Health Authority continues to increase testing capacity in our province. The past weekend, we had our 2 highest testing days to date, well over 5,000 tests completed in 2 days. So thank you to everyone that I know is working so very hard to ensure that this can occur. At our new drive-through testing sites in Saskatoon and Regina, at our mobile testing sites in our schools, and all our other testing locations, and as well in our provincial lab. Saskatchewan Health Authority labs are hiring 76 additional positions. Recruitment continues for these positions. Starting this week, the Saskatchewan Health Authority labs will implement pooled testing of asymptomatic swabs. This will allow laboratories to test more specimens with using fewer testing materials, which will increase the number of tests that they can process each day further. The Saskatchewan Health Authority will also increase the number of gene expert tests being performed provincially from 200 per week to 1,200 per week in early October. And this is due to being able to access increased supplies from our vendor. Gene Expert is the portable test that is located now in more than 20 locations throughout the province and allows for immediate diagnostics. This will significantly expand testing capacity while improving turnaround times, as it does not require the transportation of the swabs to the provincial lab. Increased testing and contact tracing, together with everyone in Saskatchewan continuing to take their personal responsibility to keep themselves as well as those around them safe. That's how we will continue to keep our case numbers low and manageable throughout this fall season and into the winter. Dr. Shahab?
Thank you, Premier. So I'll just maybe re-emphasize a few comments made by the Premier. First of all, we all have seen over the last few weeks how quickly case numbers can go up, especially if you just have 2 or 3 outbreaks, or active case numbers can go up quite quickly, as they are in Saskatoon right now. But then we've seen in the past also that if we all pull together and follow the guidelines and just follow the basic principles of staying home when you're ill, when you're out and about, maintaining that physical distance, mask use indoors when appropriate, our case numbers come down over weeks. So I think it's just a reminder that we just need to revisit those basic principles as we move along. And also, increasingly we hear of people who, had mild symptoms and thought they'll go to work, and then of course symptoms got worse, they got tested, and then as people are going to work, they're going to school, they're going to social events, people end up having a lot of contacts. So again, this is really important that if you have any symptoms, you stay home, cough, fever, sore throat, and stay home, get tested. If your test is positive, obviously you isolate for 14 days. Even if your test is negative, you stay home till you're symptom-free, usually 48 hours after the end of symptoms and any acute symptoms. And also, we've heard reports, especially, for high school students, gathering together before and after school. There also it's important that, everything seems to be working well in schools. People are limited to their cohort, mask use in other areas of the school. But before and after school, also, I think all of us need to maintain a small, consistent group of friends. Try to avoid, random mixing with a large number of people. And I think that's going to be really important over the fall for all of us, including young adults and high school and other adults as well, because that's where a lot of jurisdictions have seen transmission increase. And finally, I think there was some modeling data that suggested in Canada that there is a significant increase throughout Canada. But again, I would like to emphasize in Saskatchewan, we've done really well so far. And even though we've seen a bit of an uptake due to primarily a few large gatherings and then sporadic cases that may be now secondary to initial cases, household contacts are, as of last Friday, when we had 109 active cases, only 10% had no source of transmission. So our community, a number of people, proportion of cases who can't identify source of exposure still remains low, and that's what we need to keep it at. Test positivity remains low. And so again, we need to be sure that the number of people who we can say were close contacts remains low. They should be members of your household, member of your extended household, and that's about it. People otherwise that you meet socially or at work, you should be able to say reliably that I kept the 2-meter distance, or when I couldn't, I wore a mask. And I think that is essential to keep our numbers low overall as we go about our daily business. Thank you.
Thank you, Premier Moe. Thank you, Dr. Shahab. We'll start with questions now, and we'll start in the room. Dan?
Yeah, Premier, do you have any response to the M&S situation in Waskesiu Lake with President Glenn McCallum? Do you think his actions were irresponsible? And B, do you think that should be investigated for possible fines?
I won't comment on any particular case, but I would just say when there are cases where people have knowingly or unknowingly gone outside of the public health order advice, the public health laws that we have in place, so there are active contact tracing efforts that are underway, as well as if it's decided that it's necessary, there are active investigations that are underway.
And Dr. Shahab, has the province seen any reinfections of people who have recovered from COVID-19?
Yeah, so we have had reports of about 2 instances where there was possible reinfection, but it wasn't clear. As you know, the PCR test can pick up remote infection where the period of isolation once you're ill is 2 weeks, but rarely the PCR test can pick up 1 or 2 weeks later, which is not infectious. But we haven't seen any definite example of reinfection, but where we have had some concerns. As an added layer of precaution, we have asked the person to isolate, even though we think the exposure was further in the past. But internationally, reinfection has been reported. Occasionally it seems to be a milder illness, and what it really means is that people who've recovered from COVID may get transient viral shedding from the upper respiratory passages, which is common with other respiratory viruses as well, with influenza and other respiratory viruses, where you can get transient viral carriage, maybe mild symptoms, and it can be picked up by a PCR test, but the symptoms certainly are less severe than if you were not immune and had not been previously exposed.
We'll go to our first caller.
We have Marie Mandrick from the Leader Post.
Marie, are you there?
Sorry about that. The unmute was a bit slow. Mr. Premier, Dr. Shahab, you've seen that masks have worked reasonably effectively in schools, to date at least, because of the relatively low case numbers. I guess to the Premier, does this cause you to rethink your emphasis on mask use in general and how maybe putting forward a more strident position on mask use might be able to reopen a few things a little quicker?
First of all, I would say that most sectors of our economy and our community, for the most part, are reopened now. In the case of schools, we are, quite thankful and appreciative of the very effective plans that were put forward by the school divisions and how they are being enacted by our educators, by our teachers, custodians, everyone in the schools themselves. Myself, I have been out not through a number of schools, but I've been out in communities talking to parents that are quite happy with the fact that their children are able to return to class and are able able to return to class safely. And thus far, we have not had, to my knowledge anyway, any transmission that has occurred in the actual schools. That's not saying that we won't at some point. We've had transmission in our communities, and I think it would only stand to reason that we will have some transmission in our schools at some point, but we have not yet, which I hope would speak to the fact that it would be, fairly low transmission when that may occur. So kudos to our school divisions and kudos to our educators and all of those involved in ensuring a safe return to our classroom. Mask use, we've been very clear about mask use for many months now across the provinces, as if you are able to create that physical distance of, we've said 2 meters, but if you're able to keep that distance from others around you, you're not required to wear a mask, but if you are unable to keep that distance, you should have a mask available, and you should be very quickly put that on to protect not only yourself, but to protect those around you. So the efforts and initiatives and recommendation that we have had with mask use since the beginning has been clear. And I would say that it's been quite effective when you look at the numbers that we have had, the infection numbers over the course of the last number of months. I was on the phone with a neighboring jurisdiction of a similar population, not in this country, but a state, a similar population where their infection rates are over 10 times in excess of ours. They're up around 18,000 in numbers over the course of the last 6 months. So I think Saskatchewan can feel pretty good about where we are given the last 6 months and what we've done. Go ahead, Doctor.
Just one thing I'd like to say is that I think all the layers are important. Not going to school or work if you're sick, maintaining that physical distance when you're out about, and then yes, when you're inside a public place and can't maintain that 2 meter distance, or otherwise a public place where it is unlikely that you will be able to maintain having a mask on, and that especially applies to retail locations where you really can't control the flow of others who may be there. And then within schools, mask use where required by the school or the school division, for example, in bus corridors, in some schools in the class for older grades, and of course in schools there's that additional layer which is the cohorting aspect, that if there was to be transmission, it would be limited to the people around you within a fixed cohort, not randomly exposing the whole school. So I think all these layers are important, and as we go into the fall, we need to pay attention to all these layers, not just one aspect. Thanks.
Do you have a follow-up, Murray?
Yeah, I understand, Dr. Shahab, that all layers are important, and I get that, but the last layer added was the mask use. We now have a working model in schools where it seems to be working and perhaps arguably should be applied elsewhere, the rest of the society. We have an election coming up, and I guess I'm wondering how much emphasis there's going to be in terms of added emphasis on mask use, particularly when we're campaigning as such as we are, even little things like driving people to the polls. Mr. Premier, is your party going to absolutely recommend that people wear masks at rallies, at driving people to polls, at campaign events, or whatever else? Are we just generally going to see, considering what we're going to be seeing in the next few months, a little bit more emphasis on that mask use?
To the degree that I think you'll see people coming indoors because the weather is changing as we come to this fall, you will see an emphasis not only with an impending election, but across society with likely increased mask use, just simply due to the very clear recommendations that Dr. Shahab has put out when it comes to mask use. Is if you're unable to create the physical distance, that you should have a mask available and you should wear that mask. I know with respect to our party, there are many, if not all, individuals that are carrying a mask, and they are employing and ensuring that they are following that very public health guidance and recommendation that is there. And that's in addition to the other layers of protection that we have. Listen, I just say that what we are doing in this province, and the vast majority of the people are adhering to the public health advice that has been made available to them, it's working. Our numbers are relatively low when you compare them to other jurisdictions around the world. Where we have outbreaks and where we have some challenges are where a low number of individuals have chosen to just ignore, or to knowingly or unknowingly, or to go outside the public health recommendations that are there. And not 100% of the challenges that we have had or the outbreaks that we have had are due to that. But by far the larger number are most certainly due to, for example, someone having a larger than what is recommended gathering without some of the public health recommendations that are there in their backyard or in their garage or wherever that may be. We have seen a much lower transmission rate in the general society, in our workplaces and other places, for example, where we are able to really adhere to and seem to be respecting the public health advice and the public health parameters that are in place. So what the last number of months has spoken to is the public health guidance, recommendations, the laws that are in place are working, as long as we continue to adhere to those.
All right, we'll go to the room. Stephanie?
Yeah. At this point, are you actively considering lifting any restrictions on gathering limits? Because, I mean, a lot of the economy is still reopened, but it's still limited to 30 or to that physical distancing, and like sports can't really go ahead, and going to hockey season pretty soon. So is that actively being considered to lift the gathering limits?
I wouldn't, in my discussions, I would say not actively being considered. In saying that, there's all sorts of discussions that are happening throughout public health, and Dr. Shahab, you may have something to say to this. Many of those discussions are precipitated by requests, for example, from whether it be athletic associations, or it was our worship services and some number of religious groups earlier in our response to COVID. So as those requests come, Dr. Shahab and his team will work with those that are interested on, is there a way to conduct things in as normal as possible, but conduct the events safely. Given the tools and the layers of protection that we have available to us, and there is a layer of protection that has become available recently that I will just say hasn't had a lot of uptake across Canada, and I don't know whether it will or not, but it is a layer of protection that is available, and that's in the contact tracing app. That may be helpful if there was some larger than 30-person gatherings at some point in time. But Dr. Shahab, I'm not aware of the discussions that you've had.
Yeah, so I think several things in that. One is, of course, sports and physical activities are so important for everyone, including youth. So over the summer, leagues have been playing locally and have been doing so very safely. That 50-player limit. Over the fall, September, October, November, outdoor field-based sports like football are playing in a slightly modified arrangement, slightly bigger numbers, and they can have up to 150 spectators just sitting in fixed seating. Physically distant among households, and all that is working well. So, those same principles can be applied by hockey associations to start play in a safe manner. And then many rinks allow that up to that 150 limit, physically distant in a safe way. And so that's been working well. Can we see a place where you can have larger number of spectators? I think that would be an active area of consideration, given our community transmission rates and how you can cohort spectators safely, not just when they're sitting, but as they enter a building and leave, and washrooms and food stalls, all of those things that we've learned from so many other settings like cinema halls, for example, that have been working up to 150 per screen. You can have many screens in a facility, but it's been working very safely. So I think we need to learn and build upon what's worked well. And I would reinforce that the uptake of the proximity tracking app has been low in Canada and other countries where similar apps have been used. It's been very high in Southeast Asia, where it's a requirement that everyone should have that. But I would strongly recommend, many of us have downloaded that on Friday when it was made available to Saskatchewan. I would strongly recommend that all of us have that app, have the Bluetooth on when we go to any public place, and that will really help contact tracing beyond what we already do traditionally. I think we've seen, and I've said this before, that as we go out and about, work, school, socializing, a number of contacts are going up, and certainly we've seen that in the last couple of weeks. And I think we need to just be thoughtful about how many people do we meet within a given day, keep that number low, and in places where there's larger amount of people allowed, up to 150 in a static seating, again, follow the guidelines. Because I think whenever there's a gathering, either a private gathering of up to 30, a larger event, there's the guidelines, there's business owners who are trying to make sure everyone complies with the guidelines, but we also have a responsibility to abide by them. And for small gatherings, support the organizer in setting things up and helping the organizer so that everyone's following those rules. Because I think that's the way we can continue to have events safely like we are having now, and maybe look at a future where we can start potentially look at larger gatherings. But at this point, I think we need to be cautious. Saskatchewan has been doing fairly well. We've seen a few clusters right now. The rest of Canada, I think there's increasing concern. So I think we need to continue to watch that carefully for a bit.
Well, Stephanie?
Given that increasing concern and the uptick we've seen this month seem to be attributed to gatherings that happen in people's homes, why are you not kind of putting those in their own category where they can't have as many controls in place as, say, a restaurant or a banquet hall or church, and saying, the maximum should be 10 to 15 if it's in someone's home versus leave that room to 30 plus? Why aren't we seeing tighter rules around gatherings in people's homes?
Yeah. So I just like to say that I think that's a really good point. And in the past, like I've said, that a kind of a living room where you could pull up chairs and have maybe 8 to 10 people, you really can't have more than 4 people. And so I think we need to think through this very carefully whenever we have friends over who are not part of our virtual household bubble, and I think we need to continue to think through that. I think so far people have really been very thoughtful about that, whether it's a gathering in your backyard or increasingly if it has to be indoors. In many cases, you can't have as big a gathering in your house indoors as you could have in your backyard. So that's why I did say that we need to reset our bubble, our virtual household bubble, but beyond that, we need to be very thoughtful. Why are we having people over? How many can we safely accommodate? It's an important thing to think about during Thanksgiving, for example. But then even if we are at another venue, that we rented for an event, I think all of us have a responsibility to make that a safe event, not just the organizer. As a guest, if you see things are not working out well, I think if it's a friend who has invited you, help your host to keep it a safe event.
I would just say on that as well, those are good questions that we should ask ourselves. In particular, as I say, as we start to head indoors, but why are we having these particular people at this event that we're going to have, whether it's at our home or someone else's home, and are they in our contact circle? Are we reaching outside of our contact circle, and how many are coming? But the vast majority of the time, Saskatchewan people have been asking themselves precisely those questions. Where we have had challenges is when people have went outside of the 30-person limit that we have in place. It is, like most of the challenges that we have experienced are when someone has went offside with the public health recommendations that are in place. The 30-person limit is smaller in our personal gatherings, our household gatherings, than it is, for instance, in a, not all restaurants, but a larger restaurant or a movie theater or some of our larger facilities that we have. But yet, by and large, those gatherings have been safe. But normally when we do have a problem at one of those gatherings, there is some wandering outside of the public health recommendations, such as having 40 or 50 people, that have created the larger challenge for our numbers.
Right. We've got a few callers on the line. Who have we got next available on the phone?
We have Taylor Rattray from CTV.
Yes, this is Taylor with CTV. I'm just wondering, this is a question for Scott Moe, if you've watched any of the carbon tax proceedings, and if so, what are your impressions?
I watched a grand total of about maybe 5 or 8 minutes this morning with just a little bit of 2 of the council that we have representing Saskatchewan. I have not had the opportunity to watch any since very first thing this morning, but we're very bullish on our opportunities for success at this level of court. We have always felt that this is an ineffective tax. As we know, I have again asked the Prime Minister to put this ineffective tax on pause, not because of, but during this COVID pandemic, for sure. It's a tax that people don't need. Hardworking families in Saskatchewan don't need at the best of times, and they certainly don't need it as they're dealing with this global pandemic. It doesn't reduce emissions, it reduces jobs. We feel it's unconstitutional. We had, as we know, a split decision here in Saskatchewan and a winning decision in Alberta. So it is in the highest court of the land, and we are very hopeful that we will have a positive outcome on behalf of not just Saskatchewan, but the 6 or 7 provinces that are intervening in our case.
All right, with just an eye on the time, we'll bounce back to the room. Brian?
Mr. Premier, what do you think of the increasing radicalization that I'm seeing, at least, in regards to people's response to the pandemic? I'm seeing a lot of people thinking that it's a farce, that's not really happening, it's not a big deal, and they're getting very vehement about it. I've had 2 neighbors tell me in recent days that walking into Walmart wearing a mask, they were called either sheep or sheeple by people accosting them for wearing a mask. And there was a protest in Estevan against wearing masks the other day. So what do you think of this increasing radicalization?
It's disappointing that we would stigmatize anyone for any reason, and we've talked about that precise topic at this table a number of times before. We should not stigmatize one another in our society for any reason, whether that be wearing a mask or what that may be. The COVID-19 pandemic it's not a farce. This is a virus that is spread across the world. It's one that we had a very methodical approach right from the beginning, that we were going to make every effort to ensure that our healthcare system was not overburdened in this province, and we have done that successfully. We've done that successfully whilst we have also been able to safely reopen our economy and virtually all segments of our community, including just recently our schools. The reason we are able to do that is because the people in this province continue to adhere to the public health advice that was being provided by Dr. Shahab through his consultation with his colleagues across the country. We have worked very hard to ensure that we are taking every precaution and funded every precaution that we possibly can to ensure that we are not only able to reopen our economy here in the province, but to keep our health system up and running as functional as it can. And I'm proud to say that we have worked very hard. The Saskatchewan Health Authority and all of the individuals within it have worked very hard to recapture as much capacity as possible in not only our surgical initiatives, but our diagnostics that are being performed as well. And we're close to, not quite on the surgery side, but close to our surgical capacity pre-COVID. So this has not come about easy, because the standards and the protocols in our hospitals are very different today than they were even a short 6 or 8 months ago. But the fact of the matter is life does need to go on. It needs to go on from an economic perspective. It needs to go on in our communities. It needs to continue. We need to continue to provide the health services that the people of this province expect us, in addition to dealing with any COVID outbreaks or anything of that nature. This is much simpler to do when we have infection rates like we have had over the course of the last 6 months. There are other areas of North America that have much higher infection rates, and it makes for a much more challenging situation of continuing to operate their economy, much more challenging situation for them to continue to operate their healthcare services. So I would just ask, I would ask all the people across the province to understand that COVID is real. It is a real threat to not only our economy, but it's a threat to our family members. In particular, we have seen when COVID does move into places like with vulnerable populations like our long-term care homes, it is it is ultimately a disaster with the fatality results that we have, and we've seen that in places such as Ontario and Quebec. We're very fortunate that we have not had that impact here in Saskatchewan. So it is real. We have managed it, I think, as a population, as people of this province, very, very well. That's why we were able to shut down less of our economy. 87% of the people continued to work throughout the COVID response in Saskatchewan. That's why we were able to reopen our economy quicker than any other jurisdiction across this nation. And I would put forward that as why that I feel that Saskatchewan is in the best position to recover economically and actually get back to growing our economy here in the province. We have what the world needs as the world begins to recover from COVID-19. We have the food, the fuel, the fertilizer, we have the manufactured goods, we have the technology and innovation. We have a real opportunity to not only recover economically, but we have an opportunity to get right back on track to our growth agenda here in the province. So in light of the challenges that we have had, the fact that Saskatchewan people have risen to those challenges, I think presents us with an economic opportunity in the months ahead.
All right.
You kind of alluded to it in your statement. How do you think the pandemic and your government's response to it, including what you've done with your budget, how will that factor into the coming election?
That'll be, I guess our response has been, whether it be in the budget, whether it be in the decisions that we make on the advice that we receive from Dr. Shahab, whether it be in the decisions that we make on the advice that we receive from MLAs and people across this province, that will ultimately be, part of the decision-making process for the people of this province. Is how have we conducted ourselves as their representatives in their government? And I would expect that would make up part of the decision-making process. I would also say that another part of the ballot question, if you will, as we move towards an election on October the 26th, will be, quite frankly, who do you trust to recover the economy in the province of Saskatchewan? That is a question that I think many Saskatchewan people will be asking themselves over the course of the next number of weeks. That is a question that we will be asking the people of this province over the course of the next number of weeks. It is election season. New Brunswick has ran their election. BC has called their election for, I believe, a couple days before when ours will be held here in Saskatchewan. We look forward to going out and asking the people for their support for a fourth mandate.
All right, well, we can move back to the phone.
We have Lisa Schick from CJME.
Hi. This rise in cases that we've been seeing, does this constitute a second wave? And if not, what would constitute a second wave for Saskatchewan?
You go ahead and then I'll go.
Sorry, what was the first part of the question?
Just the rise in cases that we've been seeing over the last few days, couple weeks, does that constitute a second wave? And if not, then what would constitute a second wave for?
Yeah, so in Saskatchewan at the moment, we are seeing a few clusters that are, again, part of it is international travel, interprovincial travel, a few outbreaks, and then secondary cases. Whenever you have, for example, 10 or 20 cases, you occasionally get another 10 in their secondary household contacts. So from that point of view, I think we are watching very closely and re-emphasizing all the things we all need to do to keep our numbers low, those simple things we need to do consistently. But at this point, while we're watching our active case numbers closely, especially in Saskatoon, at this point, I would not qualify this as entering a second wave, but we have to watch this closely. And I've already said that as we enter the fall, as schools reopen, as more of us are at work, we expect to see a slight increase, but we all need to manage that in a way that our contacts are low. We isolate when we're sick. We isolate when we are COVID positive, and as a close contact, when we're told to isolate for 2 weeks, we do that consistently. And that's the way that we can navigate our way through the fall with COVID. But obviously, in many other parts of Canada, there's great concern, and in many parts of Europe, there's great concern. But at this point, I think we are relatively at a lower level of our active case rate. Our test positive rate is low, but we can't be complacent. I think we know how to live with COVID, and that's what we need to do going forward.
Premier, did you want to add anything? All right, thank you. Lisa, follow-up question?
Yeah, when you look at a graph of the cases in Saskatchewan over the last 6 months, it doesn't really look like a flattened curve as had been discussed, I guess, at the beginning of this. It kind of looks more like a series of peaks and valleys.
Yeah.
So why do we keep seeing that pattern in Saskatchewan?
So there's kind of two parts of this question. As you know, our modeling colleagues predicted three predictions of how COVID can behave. One is a slow burn, which is, you can't get rid of it completely, but you have a slow number of cases that are manageable. And then the other model is peaks and troughs, where you go up and then you put some restrictions, you tighten some restrictions, you go down, you go up again, you tighten some restrictions, you go down. And the third, of course, is what no one wants to see, is the fall surge or uncontrolled surge. I think although a graph goes up and down, I wouldn't characterize it as a provincial peak and trough. I think it's more, we have localized outbreaks. So our peak in January, in March, April was what we expected to see, people coming back to Canada. And then our peak in June, July was an outbreak in the Northwest that was very challenging, but it was through the leadership of people in the Northwest, supported by the SHA, many other partners, Public Health, Saskatchewan Public Safety Agency, that was managed, and that went down. Then we had some clusters in communal living settings in the southeast and south central parts. Again, another kind of a rise in that part of the province. Again, very effectively managed with leadership from all parties involved. And then right now, we'll see, we are going to see a bit of a peak in the Saskatoon area again, primarily linked to 2 or 3 events. So it's more of a slow burn with sporadic increase in cases, and because our overall case numbers are low, these small increases can give that cyclical pattern. But if you break it down to parts of the province, you can explain why that is so. And my final comment would be that we have to watch the test positive numbers, keep our testing, contact tracing capacity high, and watch what percentage of our cases can't explain the source of exposure. I think those are the metrics we need to watch going forward.
All right, Adam?
You're not going to comment on Mr. McCallum's situation, but he's said that he was not told to isolate after his test. Is this possible, and what should people do after they're tested?
So, I'll give you some comments on what the instruction is that's given, but then also I'll comment on what all of us need to do in any case. So the instruction is that if you are asymptomatic and you are seeking testing for whatever reason, obviously you don't have any symptoms, you're seeking testing, as long as you're not a close contact of a case, you don't obviously have to isolate because you are asymptomatic, but you have to self-monitor. So, for example, if you were at a place where there's a public service announcement, or you have any other concerns, you should self-monitor for 2 weeks, and at the first sign of symptoms, isolate. But apart from that, you can get tested, then go about your business. But at the same time, maintain those basic principles all the time: 2 meter distancing, mask use where appropriate. If you are a close contact of a case, you absolutely have to self-isolate for 2 weeks. Similarly, if you're symptomatic, you haven't been tested yet, you have to stay home, get tested. If test is negative, you continue to isolate for up to 48 hours after your acute symptoms end, and then you can go back to schoolwork. But again, with all the other precautions in place, and of course, if you're COVID positive, you have to isolate for 14 days from the start of your symptoms. So those principles are clear. That's the advice Healthline gives when people are seeking testing or when you go to a testing assessment center. So that's quite consistent. But I think it is important that even before that, if any of us is symptomatic, we need to isolate, stay home, get tested, and I think that's a really important tool to keep our transmission numbers low.
Adam, follow-up?
The BC recently took runny noses, sore throats, and a few other things off of their student checklist for symptoms. There's some parents that are concerned that, we get the flu season allergies, the kids will be having to stay home, parents will have to stay home. If they wait for a COVID test, there could be a big backlog in testing. So are you considering that at all for the checklist for symptoms for students when they go to school? Yeah,
we're reviewing all those symptoms, and we've had discussions with school divisions as well. At this point, I think people were being very cautious. But having said that, we'll be reviewing, because a runny nose that's seasonal on its own is not a good predictor of COVID, but a runny nose with other symptoms could potentially be a lower level predictor of COVID. The most consistent symptoms for COVID, especially in adults, are fever, sore throat, and pain in the throat and coughing. Those are the most consistent symptoms, but headache, aches and pains, loss of taste or smell are also very consistent symptoms, and a sense of stuffiness but not runny nose is also a symptom that can be associated with COVID, but other colds as well. But I think at this point the safest and most conservative option is that you stay home if you're unwell, or keep your child home if the child is unwell, and get tested. If you just have a runny nose and your test is negative and it's a seasonal thing or it's something that your child gets, then that discussion with your family physician and your school is important. That just a runny nose and initial test was negative, that may be fine. But I think we need to give schools some time. I think we've had a good 2 weeks. We've had about 10 schools with a single case. Certainly we were expecting that, but I think schools are settling into their rhythm. Parents are settling into the rhythm. I think we'll review, and once things are working smoothly, we will certainly, if required, change our symptom list, especially for children. But certainly the symptom list generally has worked well for us so far.
I would just add to that, Adam. The best way for us to ensure that our classrooms are safe is to keep our COVID infection rates low in our community, and the best way for us to do that is to adhere to the public health recommendations that are in place. And this goes back, Brian, to your question around, is COVID real? Yes, it is real, and the best way for us to ensure that it is not running rampant in our society and getting into areas where there all of our vulnerable people is to ensure that our infection rates are low in the community. It makes our schools safer, it makes our long-term care homes safer as well. Where there are people and where we have had challenges is when people have gone outside of the public health recommendations that are in place. Where that occurs, Saskatchewan people can feel confident that we have the contact tracing power and the experience already, as well as where there is an investigation that is needed, that will occur. That will occur, and the results of those investigations will be made public when that is complete. We've been asked, a number of times as numbers fluctuate. To Lisa's question earlier, we have these peaks and valleys due to localized outbreaks that we have. We've been able to identify them, contact trace them, and contain them in most cases wherever they may be in the province. We're very fortunate to be able to do that, and we're only able to do that by keeping our relative infection rates quite low. We've been asked, is the province considering additional measures that would have shutting down sectors of the economy, things of this nature, and we're not considering additional measures. And we don't feel that additional measures would be necessary as long as people continue to follow the public health orders that are in place. The challenges we have is when people step outside of that, as I say, and what we would have to consider or may have to consider at some point in time, if our numbers do start to rise because people continue to not adhere to the public health advice that is here, is additional enforcement measures to ensure that people are following those the public health advice and laws that are in place. When we do that, we control the spread of this virus very well. When we step outside, it creates a much more challenging situation for our communities, our schools, and ultimately those that are most vulnerable in our communities.
All right, we'll take our last question from the phone lines.
We have Zach Becerra with the Star Phoenix.
Hi there, good afternoon. I have a question for Dr. Shahab and also Mr. Livingston in regards to the pool testing. I'm wondering if you can provide a little bit more information about this type of testing and how it will work. How many specimens might be combined? Do we know the test positivity rate for asymptomatic people? And why is this being introduced right now?
So,
Mr. Livingston, would you like to start for us?
Karen, did you direct that to me, or is Dr. Shahab taking the question?
If you could.
Both, if you wouldn't mind.
Sure, I'll start, Zach. So, sorry, I couldn't hear Karen.
Okay. So
the pool testing, which has now been validated by the provincial lab, is being put in place, as you know, to help us work through volumes on asymptomatic cases. So what the proportion is it's 8-to-1. So it would be 8 swabs moving into a single test. And why that's important is it gives us more capacity to do testing on asymptomatics. It also allows us to use resources at the lab, both reagent and other staff time, in a better way. It is focusing on the asymptomatics for test capacity, and if one of those samples of 8 swabs turned out to be positive, then each one of the individuals from those 8 swabs would be swabbed individually as follow-up. With respect to the percent positive on asymptomatic, Zach, I don't know exactly what that is right now. I know that we're trying to track it, but one of the challenges we're having is with people coming into the drive-through testing. Sometimes we're getting notification that there's a very high volume of quote-unquote symptomatics coming through that. We don't believe that that's the case. So Dr. Shahab might have more information, but part of what we're doing with the analysis, particularly with the schools, as you know, when we went through the high schools last week to do that surveillance testing, is taking a specific look at what is the test positivity rate in the asymptomatics. Typically, it has been much lower, but as our testing rates go up, our test positivity rate has actually been going down. I don't know if Dr. Shahab has anything to add. I think I answered the first part of that question, Zach, but if you have anything else.
Thanks, Scott. And all I would add is that, obviously if you're symptomatic, you should get tested. And there's a few situations where there's targeted asymptomatic testing, which wouldn't be pool testing. So, for example, if you're a household contact or you're in a long-term care facility or maybe in a other setting where there's an outbreak investigation by public health, you may be a close contact, or otherwise public health needs to sort out, is there ongoing transmission in that setting, workplace. So there may be an entire group of people who would be offered testing who may be asymptomatic, but that would not be pool testing because you quickly want to know who was exposed. And even there, our overall test positive rate is well under 2%, so that's important. But having said that, for others who may be asymptomatic and testing is being done, that's where, like Scott said, pool testing is a very efficient way of maximizing testing capacity while conserving reagents and other valuable supplies. So it's a really good validated way of doing testing in where transmission is low and people are asymptomatic. But obviously we'll continue to evaluate both pool testing and our overall testing approach and continue to refine that as we move along.
All right, I think that's our time this afternoon. I'd like to thank Premier Moe and Dr. Shahab for joining us in the room. Mr. Livingston on the line, thank you very much. Have a good day, everyone.
Thanks.